Once the triage is complete, they can be moved to a patient bed. So under the room column, I'll click here in the open space next to that patient chart, and I will put them in hallway 1. That will move my patient to hallway 1 bed. Additionally, you can mark these rooms clean if they are clean, or you can block rooms. So now I'll go into my patient chart.
The ED provider will typically place orders for the patient. However, sometimes the ED providers get behind.
There are some EDRN order sets that we can place. So I'll show you how to do that. I'll go to New Sets. I'll select my provider, and I'll say Standing Order for eSign. I'll select OK. And then here I'll type in EDRN. And these are the EDRN standing orders that I can choose from. I'll select the standing orders for adults, and I'll select Next.
These are orders that are named by complaints, and by selecting the complaint, it pulls in more orders. So if I was the charge nurse or the ED triage nurse, I would select the appropriate complaints.
And then I'll select Next. I'll select Close, and it's going to pull in some reflex sets based off of what I chose. I'll scroll to the bottom, and here I can see the orders that are reflex based off of what I chose.
If the order is checked, it means that it's queued for order. If it is not checked, then it is not queued for order.
Then I'll select Next. Here I can review my orders before I place them, and if I see that one of these shouldn't be placed, I can click on this and I can undo it. I'll select Submit. Next, I'll complete some documentation. So I'm going to go to my work list.
And here I'll want to complete my complaint assessment. The complaint is the patient's chief complaint. The complaint assessment is populated by the complaint chosen in the triage assessment.
So my patient came in for abdominal pain. So I find my ED abdominal pain assessment. I'll check in the Now, and I'll select Document. So this very first one I can't chart in unless I select a new abdominal location. So I'll go ahead and select a location. And here there are pictures of the abdomen diagram and the body diagram. So I just click my drop-down arrow here, and it takes me to a picture. And the way that you would use this is you would highlight the section that you want to refer to, and then you'll indicate the type of pain that they're having. And you can also free text a note. Select OK, and then select OK again. Same idea with the body diagram, except it's the whole body.
WDL stands for within defined limits. If a body system is not within defined limits, a section will populate to provide more charting about said system.
And then I'll select Save and Exit. The other assessment that I'll want to complete is the ED past medical surgical history. I'll check here and I'll select Document. If the patient has been here before, the history will pre-fill based off of data from the last visit. And then I'll select Save and Exit. And then I'll complete my ED bedside intervention. So I'll click here, I'll click my Now, and I'll say Document. So I can select any intervention here, and it will open this section. So I'll select Comfort. And I can simply minimize these if I don't want them to be open. and then I'll select Save and Exit. I can also see that I have a home meds verified assessment. So I'll select Document, and here it just says I have verified the patient's home medications, and in which case I would need to go to the summary and then reconcile the patient's home medications.